Last night, Ebola emergency on
two major health emergencies.
An outbreak of fear as America deals with Ebola for the first time. And the enterovirus, a respiratory infection striking children and paralyzing some. A reminder of decades ago when disease ravaged the population. Days long gone.
The Salk vaccine works.
And forgotten. Across Los Angeles' wealthiest neighborhoods, state data shows child vaccination rates here lower than rates in developing nations in Africa.
It worries me that if there is an outbreak of anything, it will be here.
These moms both vaccinated their children as recommended by the CDC. But just a few blocks away at the Westside Waldorf School, the California Department of Public Health says only 21% of its preschoolers are up to date with vaccinations. 21%. Compare that to the entire nation of Liberia, which has a 72% vaccination rate. It's a dangerous trend. The richer you are, the less likely you are to vaccinate.
It's actually an alarm call, absolutely.
The result, according to pediatric infectious disease specialist Dr. Deborah Lehman, Los Angeles is now in the middle of an epidemic. The LA County Public Health Department says cases of pertussis, or whooping cough, have more than doubled in just the last 2 years.
We do see pockets of pertussis disease outbreaks, especially in areas where there's higher personal declination for vaccines.
The biggest pockets, Malibu and Santa Monica, where Dr. Dolly Weisserman is a pediatrician. She was shocked by something she'd never seen before.
Many cases of pertussis, many more than I'd ever seen anywhere.
It's not the poor communities where there's a vaccine issue. It's the wealthy communities.
Their views are being validated because they're seeing either so many celebrities or so many of their friends in the community who also have a similar mindset, and then it validates what they think.
She calls it the West Side bubble, choosing to not follow the government's vaccination schedule. Choices being supported by pediatricians like Dr. Jay Gordon.
I think the more information you have about vaccinating, the less likely you are to follow the 6 vaccine at a time schedule.
Dr. Gordon supports some vaccines, but says many are ineffective. He also argues the CDC acts like a bully, pushing too many vaccines at once. He says none of his patients vaccinate on the CDC schedule.
Isn't that inherently selfish?
Yes. I'm encouraging parents to make a decision that they feel is best for their children while considering public health.
Do you feel you're endangering the public health?
No. If vaccines work and everybody else is vaccinated, then there's no risk to them.
His altered vaccine schedule is widely criticized by public health leaders.
And when parents or healthcare providers make up their own schedules, they're really they're practicing medicine that's not tested.
Parents who don't vaccinate were reluctant to talk to CNN. But it's a big debate among them, and moms who vaccinate their children fear they'll all end up paying.
We're all in this community together, and, you don't want any type of outbreak happening.
Because then it's too late. Kyung Lah, CNN, Santa Monica, California.